Caroline Fertelman, also known as Dr. Carly, and I have over 30 years of experience in the NHS, and I'm also the mother to 3 now adult children. Strawberry Naevus, capillary haemangiomas, they're all the same thing. We just call them quite often strawberries as a sort of shorthand. They don't look particularly like strawberries, but they are red. And they develop in babies. So often a baby will have no obvious lesion at birth, and maybe a slight discoloration, like a purpley discoloration in the skin. You can hardly pick it up, but over the next few months you'll see it'll start to raise. So say if you had one in your hand, it'll be very flat, and then over a little bit of time you will see it get bigger and bigger, and it can look a bit like a bunch of grapes or a strawberry. Obviously that's how it got its name. So it's more of a red colour, not purple like my cloth behind me or my lovely purple plants. So it's a capillary haemangioma, Strawberry Naevus, and it's a collection of blood vessels that have got a bit excited and carried away. The most important thing is not to worry about it. That's the first thing. The places that you need to worry about where it is, because it may affect function, are if you find them near the eye, near the nose, near the mouth. Those are places that you would worry about, maybe down below, because people are always worried when they get sort of red lesions down below, particularly if they start bleeding. Again, that's pretty rare. So if you have a Strawberry Naevus over any part of your limbs, your tummy, anywhere that it's not going to block something off or cause confusion, don't worry about it. The natural history, that means what happens over time, is they get bigger and bigger from, I would say, from when they first appear, probably to about the age of 2 years, and then over the next 5 years they tend to go down. I think actually this is probably a bit rigid and it's fairly variable. I know some babies who only have them for a few months and then they start regressing, and then I know other children which take longer and longer. So if they're in key areas, around the eyes, around the nose, around the mouth, or down below, it's worth getting them checked out. There is treatment for it, but as you know, with anything that involves treatment, there are risks and benefits. But if it's just on the skin in a place that's not really a bother, then I think you just need to watch and wait. Of course, if it bleeds because somebody catches or scratches it, you need to sort of apply pressure to stop it from bleeding, and then go to A&E and see if you need any further treatment. So these are common. I don't think you need to worry about them too much. Of course, you can get them checked out by your GP. Besides the occasional bleeding or the ones in areas that we would be concerned about, the other slight caveat is if there's more than one. So if there's more than one, we worry that there may be some internal ones. So that's the only other thing I would slightly worry about. But for the most part, they get bigger, they get smaller, they don't cause any problem. But if you're worried about them, then please do get them checked out.